Hello, good morning, Dr. Pender.
Good morning.
My name's Benjamin. I'm a health journalist for Keep Fit Kingdom. Thank you very much for inviting us here today at your Wellbeing Centre at 58 South Moulton Street in the heart of the trendy Mayfair. You're the man in the know, so I'd like to find out a little bit more about hyperbaric oxygen therapy. So the first question of the day is, what can you tell us briefly about hyperbaric oxygen therapy?
Hyperbaric oxygen, first of all, is very, very safe for the patient. And without oxygen, we've got problems. This is often seen at birth. You have the danger of the baby developing autism and cerebral palsy and various other brain damages. So it's recognised that oxygen is vital for life. As we go through life, we get illnesses, we get injuries. If you're in sport, you pull muscles and tendons and ligaments. When this happens, inflammation gathers around the injured or sick part of the body. This actually prevents the circulation getting to the areas that need oxygen more. That area has been damaged, is getting less oxygen. So this is where hyperbaric oxygen comes in. It is giving oxygen under greater than atmospheric pressure. We breathe 21% oxygen. That's what's in the air for us to use. We can't take any more in the normal atmosphere. But as soon as you go into a hyperbaric, if it's greater than atmospheric pressure, we can increase the amount of oxygen into the body. How does that happen? Oxygen, being a gas, is dissolved very rapidly into the fluids in the body. So you've got your hemoglobin, your plasma, your lymph fluids are saturated with oxygen, and the inflammation is moved out the way, so it's anti-inflammatory, it's increasing the oxygen, so the parts of the body that needs more oxygen, that is getting less, suddenly gets more oxygen, and then it speeds up the healing. Very great for wounds and sports injuries. And thirdly, it increases the white blood cell count, which is your immune system. So inflammation, anti-inflammatory, increasing of oxygen to heal, and raises your white blood cell count to build up your immune system. So it's very effective and very safe.
Can you tell me a brief history of HBOT and where it originates from?
Right, it goes way back to 16th century. And then on to the 18th century, when the first chambers were developed. It was actually a clergyman, believe it or not, in UK, set off of pressure medicine, and it's developed from there. But probably in the 80s and 90s, it started progressing much more within the UK, in America, and over the world. Mainly hyperbaric chambers and oxygen have been used for the bends with people who have air gas embolism, with diving incidents, carbon monoxide poisoning, near drowning, this type of thing. It was utilised and it's known to be very effective for that. It's also very effective for wounds. So probably, I've been in hyperbaric for 30 years now, and I've noticed quite an expansion of the conditions that we now treat, and we get many referrals from consultants and throughout the UK, especially in London, we get a lot of referrals. And in sports side, we get an amazing number of professional clubs referring their patients to speed up healing.
Who do you think the therapy is most suited to in your personal experience? Are there any contraindications or anybody that it may not be suitable for?
If somebody's had a perforated eardrum, a burst eardrum, if they've had an untreated collapsed lung, these are contraindicated. It's like going into an aircraft and you're flying, you get the equalising of the ears, where you go under a lot more pressure, so we've got to be careful with the ears. We take great care there. We actually scan people's ears before they go into the chamber, and if there's any sign of infection or any rupture of the eardrums that we can see, we will not treat. And we take a full medical history of the patient. There is no way that they would go in if there was a contraindication.
What can a person expect from having a single session and compare that to someone who's having, for example, a session per week for 3 months?
A single treatment, probably the thing that's reported back to us, people just using single, is that the next day they're thinking and their mind and the reactions is much sharper. If you think that the brain uses 26% of the oxygen that we take in our bodies in the normal atmosphere, so when you get tired and fatigue sets in, a little boost of the oxygen into those brain cells makes a big... So they find that, boost up. People who get regular hyperbaric oxygen is usually a design treatment for different conditions, for like sports injuries. If there's a serious sports injury, like a professional soccer player, and they've got, say, a ruptured Achilles and they're on the repair side, then he would have treatment every day to heal. So it's not just once a week. It depends on the condition, and we gear the treatment pathway to the condition.
Have you noticed there's been an increase in the demand and use of HBOT in particular? And you've answered the question before, but what kind of people use treatment here?
There's certainly a bigger demand. We reckon that in the last 6 months here, just in London, across the UK, mainly because we're doing such a lot of work here, there's been an increase of about 60% of interest in hyperbaric oxygen. Worldwide is the same. So people are taking notice of it. What kind of people in the sports world that we treat? Well, we have treated players from Newcastle United, Crystal Palace, Watford Football Club this year, so it's quite a wide expanse. Professional golfers, European heavyweight boxing champions, and professional tennis players at Wimbledon. They came here for treatment. It's interesting in the sports world. Before players' legs get tired, their brain gets tired. And 3 years ago, I did a study with one of the Premier League football clubs who were sitting at the bottom of the league. Now, if a club in the Premier League is relegated, it's talking about £20 million plus they're going to lose. So we negotiated with the players. We noticed that this club, in the last 20 minutes of each game, they were either losing silly goals or missing chances, which tells you that fatigue is setting in the mind, so the decisions are not sharp. So we asked if we could have their 3 key players, a striker, a midfield player and a central defender. And they came down 2 days a week for 1 month. And on those 2 days, they had 2 sessions each. At the end of the month, we then discharged them back to their club, and their performance physician, he was monitoring, and their performance was raised up by 35%. So this fatigue, tiredness was gone. As a result, with 8 games to go, they won 6, drew 2, and they saved relegation. The following year, they did the same, and they won the Premier League. Thereafter, they were involved in Europe, so they couldn't afford the players to come to us, but we proved the point that in the sports world, if you want to enhance your performance legally, then hyperbaric oxygen could be a way to go.
So, Dr. Pender, do you think this type of therapy will continue to rise, and why do you think that might be?
I think it will rise mainly because it's effective and it's safe. The next reason I would say that it will progress is because people are getting tired of the pharmaceutical, with the side effects that pharmaceuticals are not demising the pharmaceutical industry, because they've made great advances in a lot of illnesses, but some of the side effects is quite horrendous, and people now are much more greater educated on what's going into their bodies and diets and so on. So I think, people are looking for more a natural way of health, although oxygen is a prescribed treatment, and it's, as well as well-being, it is also medical, but it's very safe and very effective.
Would you say there are any metrics or ways which a person can measure their progress before and after HBOT sessions?
We get feedback from the patients. We had one lady in the other day. She didn't come in for this, she came in for well-being, but seemingly for years she suffered with cold legs would never get warm, and halfway through the treatment she got quite excited in the chamber. When she came out, she says, my legs suddenly became warm, and as if the circulation had just been switched on, and since that day our legs have been nice and cozy and warm and comfortable. So it's that type of feedback we get.
How would you assess how many sessions a person might need in order to experience relief or improvement in their conditions and symptoms? And do you think it may be effective for people with chronic pain?
People come in who have got fatigue and tiredness. I wouldn't say they've got fibromyalgia is a sort of a wide span of a name. It covers so many things. It's a condition. It's not a condition. It's a name that the medical profession now are given to something they don't know what's going on. It's usually the immune system. But just say somebody's got mild fatigue, then I would recommend that they go and have 5 sessions and they have minimum 2 a week. That way they would have fairly good response. If somebody comes in with chronic fatigue, which are going into sort of a Lyme's disease and lupus, you could be looking at 40 sessions. Sports injuries, again, it depends what the injury is, and it also depends what sport you're in. If you are valued at, say, £80 million as a soccer player, and you're sitting in the stand, the chairman wants you on the field pretty sharpish because he's not making any money out of you. So there's lots of things, but the thing is I'm concerned about is not helping the chairman out to get the player back. My interest is only in getting the player back in good health when he's ready.
Last question of the day. If a person watching this wants to experience a session or sessions for themselves, what's the next step forward for them?
Phone up a reception and make an appointment, and when they come in as a first-time patient, they would fill in a questionnaire, and a questionnaire would go through their history. We would even ask them if when they're flying in an aircraft, do they have problems with their ears? We're down to the smallest detail, and we want to know as much as possible. And then we look at it, and when they come in, they get a check of their general health, their blood pressure, their oxygen saturation, run through their questionnaire, and we do video and scan their inner ear, which is very important when you're going to put a patient under pressure.